Hello everyone. Today I am going to discuss about nursing informatics. So these are the objectives. At the end of the session, you will be able to define nursing informatics, describe the benefits of healthcare informatics and technology for nurses, and explain the use of telehealth extension codes. Let's see what is nursing informatics. According to American Nurses Association, nursing informatics is a specialty that integrates nursing science with multiple information management and analytical sciences to identify, define, manage, and communicate data, information, knowledge, and wisdom in nursing practice. In simple, what we do in nursing informatics is we use this computer and information technology to assess patient and provide nursing care. As nurses, you can use this technology to record patients' data, to communicate with other healthcare team members and clients, and provide nursing care efficiently and effectively. You know that nurses traditionally involved with lot of paperwork and had the need to file and retrieve a variety of forms and other paperwork. Now we can enter this information into a computer database and thereby you can retrieve the data as needed. So it saves time and facilitates communication effectively and effectively. When we look at the model of nursing informatics, we can see nursing informatics is a combination of nursing science, computer science, and information science. These three components together form the discipline called nursing informatics. When we look at the field of nursing informatics, a system to work best for nursing, it must work for the entire healthcare system. Means this technology should be used in all the departments like medical department, nursing department, clinics, laboratories, pharmacies, etc. These systems should be efficient and should be able to use high quality care. For that, right software should be installed and need to modify as needed. And this system should be communicated between local facilities to integrate patient care, because as nurses you have to communicate with all the other members of the healthcare team when you provide nursing care. And also it is important to provide a training for nurses how to use these systems. Depending on the place the nurse works, the informatics nurse has many titles such as nurse informatist, a clinical system analyst, an informatics nurse specialist, etc. So all these titles refers to a nurse with knowledge and experience using technology and applying this knowledge into all facets of nursing practice to improve nursing and patient care. Information nurse specialist is an advocate and voice for nurses in matters involving electronic medical records and other applications of technology to nursing care. Information nursing specialists coordinate system analysts and information services to conduct a needs assessment when documentation issue or need arises. And information nursing specialist serves as nursing representative and advocate during system development discussion, because the information nursing specialists have the knowledge on both disciplines, nursing and information technology and information science. So information nursing specialist bridges the gap between technology and nurses' clinical needs. Now we see what are the benefits of healthcare informatics and technology for nurses. First on, it increase and simplify communication between healthcare personnel, and it reduces the communication time between clinicians, and so they can use this time for patient care. Second, you know that nurses have much to monitor when providing nursing care, but with the development of automated patient monitoring systems, you can monitor a lot of information at once. For example, you can monitor all the vital signs at once using monitors. So it reduces monitoring time, and this time you can use for patient care and save more lives. When there is electronic health records, as nurses, you can retrieve this information at any given time when you need the information. So when the legal problems also arises, you can use this information to protect yourself. So all of this frees the time of clinicians, and they can be spent more time with patients. Now we see how nursing informatics impact on healthcare. First, using nursing informatics, nurses can gather data rapidly using electronic medical records and other clinical systems. So, nurses and other clinicians can provide efficient care. Second, informatics maximize the use of mobile technology and bring healthcare to homeless. Means it is not essential to go to the hospital or doctor, and by staying in distance place, the physician can monitor patient and give instructions. Third, information nursing specialists can participate to develop predictive models by analyzing the risk of patients for readmission to the hospitals. Finally, we will see what is World Health Organization family of international classification. Actually, it has 3 reference classifications covering diseases, functioning and disability, and interventions. Those are International Classification of Diseases. I think that you know more about this. And international classification of functioning, disability and health. Then finally the international classification of health interventions. So to get a broad idea about these classifications, please go through your textbook. So like these classifications, telehealth also has a classification. So it has a coding system. So XH01 refers to the interventions performed with advice or assistance provided from a distant location. Here, the advice provided is not in the hospital or the place where patients stay. Advice provided from a distant location. So, H02 refers to the intervention provided to recipients in a distant location. Here, the advice or advice recipient is in a distance location and receive advices maybe through telephones, like telephone counseling. H03 refers to the interventions delivered via technology without direct involvement of human provider, such as interventions delivered via website or healthcare apps, or it involves e-health and m-health interventions. So, in a summary, I would like to say nursing informatics is broad, accommodates a diverse array of nursing strengths and interests, and impacts virtually every aspect of healthcare where technology integrates with clinical practice, no matter the setting. Nurses who choose informatics as a career expand their reach beyond direct patient care, but they still experience the rewards of helping people and advocating for their profession. Okay, so if you have any questions, you can direct them to us via mails or through mobile phones. And thank you.